Do people have other areas of research that are exciting you? We've talked about some in the healthcare system. You talked about implementation science. Other areas of research that might be exciting?
There is some research being done using psychedelic medicines to decrease certain addictions. There's been a study out of Johns Hopkins using psilocybin. Interestingly, it seems counterintuitive to some degree, but using psilocybin to help tobacco dependence, and given the relapse rates for tobacco use, this was actually extremely effective. For I believe it was in the 70 or 80% still did not relapse after a year of, if I remember exactly. So that's very promising. There are some places that are looking at ibogaine, although not so much in the United States, for the treatment of opiate dependence. There's a Schedule I drug in the United States, not prescribable. There's others that are looking at things like ayahuasca and psilocybin for other addictions. Generations ago, LSD was used very extensively for alcohol treatment, and there are literally hundreds of publications that are about 30, 40 years old about that.
Kind of went underground for a while.
Kind of went underground, and there's a resurgence in that research lately.
So novel pharmacotherapies that are coming out.
But those are always medication-assisted therapies. It's kind of a different approach where the medicine and the therapy work very actively together to create a change in how people see themselves in relationship to the substances.
So the medication is actually used to enhance psychotherapy?
Exactly, and it's very limited. It's unlike Suboxone, you would take it every day, like the ibogaine treatment would be once or twice. And along with the therapy, can show to be quite helpful. Yeah.
Yeah, and I think the importance of all that, and even thinking about cannabis as a treatment for certain conditions, the bottom line is allowing us to research these things in meaningful ways so that we can create an evidence base and really be able to think about, if the evidence is there, how we really roll it out in clinical care.
Since you're bringing this up, do you mind talking about why it's difficult to research cannabis?
So as Rob mentioned, cannabis, like some of the substances he was mentioning, remains a Schedule I drug in the eyes of the federal government. And although states allow different varying legislation within their states, at the federal level, cannabis is a Schedule I substance, which really means there's no therapeutic benefit, and risks clearly outweigh any potential benefits that may exist. And so it makes it really hard to study this. Now, with that said, many of the National Institutes of Health are really taking this head on and funding research in this area. So I think that, stay tuned.
There's also some methodological problems with a lot of the natural remedies like cannabis or ayahuasca, ibogaine. That each preparation can be very, very different. So it presents a problem for researchers to study, even if it were permitted to study.
Right.
And while we've thought for a long time that cannabis, for instance, the active ingredient is THC, it turns out there's a dozen other compounds within it that may be more effective, or in certain combinations may be effective. So studying some of these things is really a complex.
And effective for what?
And effective for what? Yeah, some effective for anxiety, some effective for pain management, some effective for
seizures.
Yeah.
I am optimistic that we may see more cannabis research, because the Drug Enforcement Administration, which has put the hammer down on all kinds of drug use in this country, has actually said that next year they're going to allow more marijuana to be grown for cannabis experimentation, medically controlled experimentation.